Hello and welcome to episode 5 of the Diabetes QI Collaborative podcast. We're joined today by Dr. Liz Baker, consultant paediatrician, and Jo Ellis, Paediatric Diabetes Specialist Nurse from the York and Scarborough teaching hospitals. Liz and Jo's teams were in the Sheffield wave, it's wave 10 of the QI Collaborative, starting the programme back in October 2020 through to completion in May 2021. In our conversation today, we'll be talking about the team's QI project, about improving clinic experience, how they arrived at their areas of improvement, any difficulties and barriers that came up, as well as their plans for future improvement. This podcast has been brought to you by the Royal College of Paediatrics and Child Health. My name is Matt Oultram. I'm the Quality Improvement Project Manager, and I'm hosting today also is Jess.
Hi, I'm Jess Ellis, and I'm a Quality Assurance Coordinator at the RCPCH.
Just so we can get started, would you be able to tell us a little bit of background information about your service, such as the patient population, any particular challenges, and where you are?
Yes, we have a sort of different setup in York and a separate team in Scarborough, although we are trying to combine a lot more of the trust and trying to work more cross-site. I think I mainly cover the sort of Selby patch, which is a smaller sort of group of about sort of 25 patients, but then we also have York separated into sort of younger children and the transition clinic as well, and I think in total we've got about, I think the last count, about 160 patients on the book. I think that's right, Jo?
Yeah, I think it's about that. Yeah, now we're jumping up.
Yeah, it's felt like a busy year.
Yeah.
Sure, and how did you become involved in the QI Collaborative then? And particularly interested about how you, your interest in becoming QI champions.
So I think that it started off really from we did have some quite disappointing results from the MPDA in terms of our Hba1c, but also our PREMS results as well. So we were a bit of a negative outlier. So I think we thought, whilst we had some individual ideas and how to improve it, we thought actually it'd be useful. And it was really our clinical lead, so Wendy as well, who'd sort of suggested we go forward as a team. And again, it's been useful to do it, and also the Scarborough team doing it as well, just to try and sort of have a bit more formality or having some more momentum and motivation to actually see it through. So I think that's been really useful. And then I think in terms of how we were... So to be QI champions. So I think Jo was first to volunteer. So I thought, oh yes, I'll get involved as well. I think again, it to give a bit more impetus to, okay, let's get things going, and to sort of share out amongst the team in terms of other activities that were going on.
And had you done any QI work before this? Had you had any previous experience in this?
I think...
No. Sorry, Liz, you go.
I was just going to say, did you have any, because I know you'd been doing a different course, hadn't you, at Birmingham, so I didn't know if you'd...
Yeah, there was some bits in my previous role, and then, I'm quite relatively new to the post of PDSN. I've been in the job about 2 years now, but I was quite keen to look at how we could adapt our service and our approaches really to patient engagement, and particularly because I look after teenagers, so 14 to 18, and looking at ways that we can get them more involved in taking a lead in the service really, and keeping them at the sort of the heart really of everything that we do, and developing it that way. So the opportunity when it came up to be the QI champion along with Liz just seemed quite exciting really, to see what we could do with our service.
Great. Can I ask what your process for identifying your areas of improvement was?
So we're quite a big team really, and some quite strong personalities, I think it's fair to say, or some louder than others. So we decided there were quite a lot of ideas. So we started off with sort of dividing ourselves into 3 groups really. And then we started off with 3 streams that we're sort of looking at. I mean, overall, we wanted to just improve engagement, because then we thought, well, that will then hopefully translate into improved, positivity and our PREMs in terms of their clinic experience. But also, we thought that would have a knock-on effect if they were more engaged in terms of them management and improved HbA1c. So we looked at the areas and we thought, well, actually, let's look at clinic experience as a whole. So some of that might be just around environment, the discussions, the sort of language that we were using. So that was one stream. Another one looking at the first year from diagnosis and looking, okay, how do we get off to the best start to set those sort of practices in motion. And then we also wanted to look at downloads and some of the IT. So we started off with the 3, but I think then it became clear that actually some of them were very big topics and it was hard to divide into smaller sort of focused areas and small improvements. And again, I think we were splitting ourselves up too much to try and do that. So although we've still got some of those as future developments and they're still part and parcel of sort of everyday work, I think we decided that something for more practical reasons and that we could do a lot of small changes and do quite quickly and assess that was the clinic experience side of things.
Okay, thank you. And could you tell us a bit more about some of those initial changes that you made to your clinic?
So we did. Some of them were shamelessly stolen from some picked up from the other groups and presentations we had, which were really useful. So simple things like the tokens that we used just to gain a quick "How do you feel about clinic today?" So that was easy to set up and we had quite positive results from that. So hopefully that'll translate across to the Prems as well. I think the big change that we really thought has made a difference is we have our communication sheets that we give out at the beginning of clinic now. So just saying what do they want to talk about. And we've got various topics from, school, holiday, and we do have technology, blood sugars. And the vast majority, to be fair, do talk about what we want to talk about. So they do generally tick blood sugars and pumps and technology, but they might pick a couple of other things about holidays, sport. But I think it means that we still talk about everything, but it's done in a way that they're involved and they're engaged, so it feels like they're having some sort of input. So we'll start off and say, oh, right, you've ticked this, what was it particularly? And I do think that just from how they respond to that, we've had some children that before would just sit and they might grunt occasionally or not really participate, but they have seemed to be much more engaged and it feels a much more positive experience. So again, hopefully that'll be translated in some of our Prems and results, but it does feel that that's a real sort of made a positive change.
So you mentioned, I think, that you've borrowed some of those ideas. Are there any other ones that you've borrowed from other services, and how did you adapt them into your own service?
Just trying to think. I mean, we've put up lots of posters and put more sort of age-specific activities about, and I think just making the team more visible. So we just have posters about who's in clinic today, because again, we had some feedback that they weren't sure who was in clinic. So, just simple things. I don't know, Jo, have we stolen anything else? I'm sure we must have done.
Like with the sort of empowerment and engagement, we've been thinking about our first year of diagnosis, and a lot of other areas have got quite good sort of structured workbooks that families would go through in that first year. And we don't necessarily have anything. We do deliver all the education, but we don't have any workbook as such. So we thought one of the groups worked on how we can improve our first year of diagnosis. So through that, we've sent out a questionnaire to, I think it's about 26 or 27 patients diagnosed within the last couple of years, and just getting their feedback really on how they think how effective they think we've been at delivering the education. Because although we think we cover everything, sometimes it's good to get that feedback to see how they feel, and then going forward, we'll hopefully be devising a workbook of our own. But at the minute, it's just trying to get people to respond to the questionnaires. We've had some responses, probably about 30%, but we just want to try and get a few more just to get a good overall view, particularly from the teenagers as well, actually, about how they feel about the education.
I'm interested in, you may have mentioned it already because I'm thinking about lots of different things here, but you're improving clinic experience. What kind of focus was there on the different age groups? Because I think having a clinic for teenagers might be a very different experience for those who are, age 2 to 3 or something like that. Then, how did you feed that into the work?
So I think, yes, we were trying to have some sort of age-friendly materials or quizzes and things like this. Unfortunately, COVID sort of impacted that a bit, because even when we came back to doing face-to-face, we're still limited about, we can't have lots of games and toys and paperwork, out and about. So that's been an impact, but we were conscious about various posters. Another thing that worked really well was our logo competition for DigiBeat. So I think that worked well as well. We've got a lot of posters up about DigiBeat and trying to improve, and we have sort of improved our uptake of that. But we had some good entries in terms of our competition. So yes, we have got, we're thinking about reading materials and what's up on posters and things like that, and trying to make them more age appropriate. Like we'll have, so for the teenagers, there'll be a lot of sort of lifestyle sort of leaflets and services and things, but yeah, it's slightly hampered by COVID.
I'm just wondering if you were able to get patients involved in any of your QI work, and how you did that.
So the big part was probably that logo competition. So that were, a big part of getting them involved, and we had some really quite insightful. We were really impressed by those. I think we have been asking, so a bit of that feedback around the workbooks and a lot of these questionnaires as well. And getting to... Sorry.
We've sent out questionnaires about a home downloading tool as well that we had, just to get some feedback on how they found that and if it was practical or not. But again, it's the responses that we struggled with. So that's something that we're going to look at in the future, of how we can. Is that something you do face to face in clinic, or but we have tried to keep families and young people involved throughout the process.
And we did particularly highlight, and we've been thinking about certain patients and parents of different ages and who might be good to be as part of, thinking ahead to when we are a bit more face-to-face and group works, as to who would be good to be, patient and parent sort of representatives.
You sound like this project's been really patient-focused. I think by its nature, with improving clinic experience, you've got to the experience of the child and young people at a really early stage through this and throughout. And one of the things that we cover a lot of in quality improvement is just that ability to get fast feedback on your initial interventions. And this can be quite difficult to what we often used to do. We're often used to kind of research projects as a way of getting data and audit. But you've gone straight into kind of getting that fast feedback there. I think that's really positive. And I just wonder if you have any recommendations in a way to other teams about a good way of doing that, good practice, what works for you, because perhaps quite a lot of the things that we struggle with is the uptake in patients wanting to give feedback isn't always very high, especially if you have only a few patients to begin with. What are your thoughts on that?
I think, to be fair, it did take us a while to focus on that. I think we did a lot of time thinking about things we could do and the improvements, and then suddenly I think then it was only when we focused down. So I think it'd be, don't make it too busy with too many ideas, and focus down. And then a lot of the things, so the ones we got instant feedback are the ones that you can do in clinic, so you capture them there in terms of that communication before they come in. So it's something for them to do, maybe whilst they're waiting for their Hba1c to come back and come in. So you're not giving them something lengthy that takes a lot of time. It's a very quick visit, it's pictures that they tick, so it's very easy to do. And the same with the tokens, it's a very quick, just put it in whichever you like, and as part of the clinic process, and making it a sort of maybe slightly fun, sort of slightly different, but it's not taking up a lot of time. I think the problem is, like I say, the lengthier questionnaires that we've sent out, and that's always the case, we're struggling to get those to come back. So I think it's trying to keep things very quick that you can do in clinic, and then you can, and actually after each clinic you can quickly tot up, so you're not spending ages also then trying to go through results afterwards. So that's quite easy to do. And then we also were just sort of matching, looking at Hba1c results as well, which do, whether it's, we'd like to think it was a part of the QI and all the other things, but it has come down over the course of the QI as well. So we're hoping that reflects a lot of the improved engagement and some of the other sort of methods we've put in place.
Do you store and display that data then to the rest of the team, or is that something that you studied together?
So I think we did sort of send it round as we were going along with, and we're still trying to give updates around, so particularly the communication sheets, and saying, look, this is how many we're getting and how many we're doing. As we were getting the counters, the feedback tokens and things, so keeping that up to date. So yeah, I think it's better. That would be a good tip, I think, is don't wait until the end for the sort of ta-da moment of this is the final results. I think it's nice to see that, and it's more motivating to say, oh yeah, it's coming down and chipping away, and those sort of regular updates I think do make a big difference.
So you've talked about getting feedback from people. I was wondering whether there were any other ways in which you could see that the changes that you were making were improvements, and if there was anything that you found was not necessarily an improvement.
I think it was hard from that because we had big plans around the downloads at the beginning and our download tools, and I don't know whether that made it more complicated or that hasn't really sort of taken off. We do seem to have had more people downloading, but I suspect that's a positive benefit of COVID itself, in that we're doing less face-to-face people and people didn't have anything else to do. So I'm not sure we can claim all of the glory for that. I'm just trying to think. I don't think anything made anything more difficult or was a particular, not waste of time, but it wasn't really an improvement. I don't know. What do you think, Jo?
Yeah, I would just agree with you there. I think the downloading was it's really worthwhile, but appeared to be the weakest area that we've managed to develop. So that's something we'll have to work on in the future. It's been the hardest one to develop.
And just following on from that, did you get any feedback that made you think we should be doing something slightly differently and adapt or change anything that you were doing?
I don't think so, because the feedback we got from the download tools was positive, but I think and we tried to sort of vary, we didn't just send it to people who were already engaged, because that's the problem. A lot of the time you only get feedback from people who actually are already engaged and are doing it anyway, so it's how you get the other people. So that's always the problem. And I suppose the same with people who sign up to Digibeat. So that's it. But I think from the other things from the clinic and the feedback and the communication forms, because they were slightly, it was something to fill in there and then, even if they only ticked one thing, they did all. I don't think we had anybody who just didn't tick anything, or we used that as you haven't ticked anything in particular. Is there something? It was still an opening to talk to them. So I wouldn't say we had anything that was slightly more negative or less positive.
I was really interested to hear about, I know it was one of the other options that you've done in one of your work streams, and that was to, with the help of your psychologist, improving kind of consistency of communication. And is that something you've managed to pursue so far? Is it something you're looking at doing it, or if you have, then it'd be great to find out a bit more about that.
Yes. Yeah, we had a good session, didn't we, Liz, with our psychologist. We set up a session about the language we use during clinics, just to again help with engagement and making sure that that's not going to become a barrier if we're using the wrong language, and just being aware of how we can talk to young people and what the challenges are when working with them people. So I found the psychologist session really useful surrounding language and the change cycle, and not sure if you've thought anything else about that, Liz.
Yeah, no, I was going to say it's that stages of change, and it's sort of recognising when they're going to be amenable to, so it's just the timing of those discussions as well, not just the sort of terminology. But yeah, even though we often think we're all saying the same thing and on the same wavelength, just sometimes it can be just subtle differences, but also picking up the sort of non-verbal cues and making sure that actually is this the appropriate time for that discussion So no, we've been really, really lucky and to have her as part of the team and really engaged and part of this QI. And in particular, she was in there, wanted to be in that strand of improved clinic experience.
Great, and we're just going to the final stages now. So, you've identified an area to work on. You've picked up on improvement areas. You've got feedback on that, and you're kind of expanding on those changes now. So, what was the effect on your outcome data and MPDA if you've got that? If you've got those figures to hand?
So I think looking at our Hba1c data in particular, so yes, I remember to look it up. So I think over the course of between the start and the end of the QI, and I have to say I should have looked at if that's been continued, but we did have an overall reduction in the mean Hba1c by 8 millimoles per mole, and also looking at those, so we had a particular strand that was the new diagnosis. So actually, again, we've improved for the similar sort of period the year before. Our mean HbA1c at 6 months following diagnosis is down from the year before at 5 millimoles per mole lower than previously. We have got 100% of our new diagnoses this year are all downloading from the start, so that's a big difference. And again, the Digibeat uptake, I think that doubled over the course of the QI project as well. So hopefully that'll still be sustained.
Those sound like really fantastic outcomes, and I'm genuinely very impressed that you've managed that. Can I ask, did this have any effect on your team or any of your team relationships at all?
Well, I think that's been the biggest positive in some ways, as well as obviously for the clinic experiences. And I think especially coming, because I think at the beginning we were probably a bit disappointed that, we're not able to do this face-to-face and pick up, that brainstorming with other teams and things like that in those over a cup of tea sorts of conversations. But actually, I think it coming in COVID, it actually really helped because it gave us a reason we met more often, we deliberately said, let's meet on a weekly basis, knowing that not everybody would make every week, but at least most people would drop in every couple of weeks. And even if it was just a 15 minutes to say, how are we getting on, any problems, how is everyone? And just to keep the team sort of momentum and morale and keep us all sort of linked in, really. And I think it also worked that everybody, so like I said before, we are a big team and there can be some people that are, stronger personalities than others. But I think this helped. Everyone played a role and everyone contributed, and sort of how the smaller subgroups were separated out. Everybody contributed and got involved and got engaged. So I think it was a really, really positive outcome on that team, sort of team working and communication. And I like to think that's carried on, and we're still having sort of regular meetings and things as well. I don't know if Jo would agree.
Yes, I would agree with that. Yeah, I mean, we also tried on our QI days as well that we, mainly due to COVID, that we couldn't find anywhere in the hospital big enough to house us all, but we managed to secure a venue away from the hospital actually, which was really good. So we had like an away day where we could really focus on the QI, and we made a full day of it, and it was actually a nice bit of team building day, and you're away from the pressures of the hospital, so that was really helpful as well.
Just wondered, as leaders in QI within your team, how do you keep up momentum, especially during challenging times such as COVID and particularly recently large numbers of newly diagnosed and so on?
So I think it is that regular catch up and probably regular feedback still of things to make a change. So I won't say yes, we have taken the foot slightly off the pedal, but I think maybe it's time, and then it's looking at okay, now let's focus maybe more on the downloads as a longer term project. So I think it's afterwards to maintain that momentum. I think it does need to be still carrying on the regular meetings, regular catch-ups, right, what's next? Is there a new project? Or right, have we finished that one? Do we need to now start something else? I think just feeding back where we are and going over the sort of outcomes. So I think it is. I think it's that's probably been a bit more of a struggle, but we're trying to keep on with that.
I was going to be asking what's next for your service. Have you thought about whether you're going to just continue with this project, or is there something else that you've got your sights set on for the future?
Well, I think we are looking at, because we're collecting some of the PREMS data at the moment, aren't we? So that'll be good and hopefully will reflect some of the work on the clinic experience. So I think we'd like to think we're always going to be looking at that clinic experience, particularly as we're managing to get a bit more back to normal. But I think downloads is probably going to be the next thing to try and just to get, and not necessarily, we have most of our patients do know how to download, but it's getting them to do it independently or in between clinics and not just before they come to clinic, and making those changes themselves, because I think that's where we need to sort of improve next.
Yeah, I think we've still got some good areas to work on. So we've got our structured education workbook and the home downloading, so we'll probably just focus on them areas next and see where we can get with them.
Okay, and just a final question from me. If you were to give, I guess, for services starting out in QI, particularly in the area of improving clinic experience, is there any kind of 2 pieces of key advice you would give to them?
So again, I'd think just simple things, and start collecting, feedback in the clinics straight away, but regularly feeding that back. What else? I don't know, Jo, anything else we'd do differently or sooner?
Yeah, I would agree, really. Just I'm not sure if postal things are a thing anymore. I think they're quite outdated, so I would say either trying to grab people in clinic settings to fill out any of your feedback forms, or looking at like an app based, sort of like a Survey Monkey or something like that, just would help, I think, with gaining feedback a bit easier.
And I think just keeping it simple as well. I'm a big fan of very picture things. We do a lot of simple things like with the Hba1c cards, even when they changed it, just quoting sort of numbers, particularly when it changed from, percentages to millimoles per mole, but the cards that we have are very, your traffic light or, colours of what's red is high, green, just simple things that make it a bit easier as well. And then you can see, patients again seem to engage with that more. You can see them sort of glossing over when you start quoting numbers and things. So I think it's keep anything you can do in sort of picture form, keeping it simple. I think for teams who've got psychology input, I think get them involved for the whole clinic experience, and I think that language and terminology from the start, I think that makes a big difference.
Liz, Jo, it's been great to speak to you today. What we encourage a lot of in the QI programme is a sharing of ideas. It's been great to hear how you've borrowed ideas from other diabetes teams and adapted them to improve your own service. This can really save a lot of time compared to doing everything from scratch. You've also found effective ways of testing out changes on a small scale and finding out as soon as possible whether your improvement is having an effect. Through our PDSA cycles, this allows us to find out quickly whether a change is working or whether we should adapt or try something else. It sounds like you have a number of potential areas you'd like to improve. We wish you the very best in developing these. To our QI Collaborative teams, on our website, there's a growing number of recorded presentations and posters from many of the teams who have taken part in the programme. These cover a range of topics such as transition, patient education, carb counting, and high Hba1c pathway. Also are our QI instructional videos designed to inform you of QI tools and techniques. To get access, please email us at diabetes.quality@rcpch.ac.uk.